Hi, my name is Michelle Embleton, and today we're going to be talking about what are the differences in pregnancy with fraternal and identical twins. The presence of one or more embryo growing within the womb of the mother is called a multiple pregnancy. This can lead to twins, it could be triplets, quadruplets, or possibly even quins. However, the most common occurrence in a multiple pregnancy is twins, and we're going to focus on this today. We must remember that when we talk about twins, there could be two different types. These are identical twins and fraternal twins. Identical twins, as the name suggests, are identical genetically, look alike, and are always of the same sex. Fraternal twins, however, are not genetically identical and can look alike the same way that brothers and sisters generally look alike, and they can be of different sexes. However, multiple pregnancies and twin pregnancies are considered to be higher risk pregnancies because of the risks they carry for the mother and the baby. Dizygotic twins occur when two eggs are fertilised by two different sperm, and the two resulting embryos implant into the mother's uterus. These are often known as fraternal twins or non-identical twins. They're not genetically identical and can be of different sexes depending on which sperm fertilised the egg. They may be alike physically, but they won't be identical. They may be alike as are siblings. Fraternal twins generally account for about 70% of the cases of twins. In contrast, monozygotic twins are formed from a single egg and a single sperm, which after fertilisation splits into two separate embryos, which then grow together in the mother's uterus. As they are formed from one egg and one sperm, they're genetically identical, hence the term identical twins. So they will always be of the same sex and usually grow to be virtually identical in every way. These account for approximately 30% of the cases of twins. In the case of identical monozygotic twins, we can actually classify them further depending on when the split of the embryo occurred. The time in which the embryo has divided into two individual embryos can affect whether they share a placenta or an amniotic sac. If the embryo divides early at the blastocyst stage, it is likely that each embryo will then go on to form its own placenta and its own embryonic sac, the technical term being bichondrionic pregnancy. If the embryo splits a little bit later, between days 4 and 8, each embryo will develop its own amniotic sac, but will share a placenta. Hence the technical term monochorionic biamniotic pregnancy. After this, if the split occurs a little bit later, perhaps from day 13, it may be that the two embryos will share both the placenta and the embryonic sac. Hence the term monochorionic pregnancy. If the split occurs after an advanced stage of embryonic development, after day 13, it may be that the split of the embryos is not fully complete, and this results in what we know as conjoined twins, where the twins are actually joined in some way physically within their body, as well as sharing a placenta and an amniotic sac. Dizygotic twins, being made of separate eggs and sperm, and therefore separate embryos, will always form their own individual placenta and own amniotic sac, hence being bichorionic amniotic pregnancy. Multiple pregnancy usually carries a series of increased risks for both the mother and the baby. A summary of these would be possible low birth weight of the babies, an increased fluid retention in the mother. There is an increased risk of preeclampsia and also of premature birth. It could also be that one or more of the babies has a delayed intrauterine birth, or perhaps the mother may suffer from gestational diabetes. It's also possible that there may be some chromosomal alterations, so it may be a good idea to have the genetic studies performed at the correct time, according to the advice of your specialist. In the case of monochorionic pregnancies, where they share a placenta, it may be that a syndrome called fetal-fetal syndrome occurs. And this is where one of the babies is actually getting more blood than the other one. But there is a solution for this. There are many factors that can come into play when looking at the possibility of having a multiple pregnancy. The first I'm going to talk about is the hereditary basis. It is true that in some families, twins seem to run in the family. Although we don't know the exact genetic basis of why twins occur, there does seem to be a genetic predisposition, especially in the case of fraternal twins. So if you have twins in your family, it may be that you might have them too. Also, the maternal age can make a difference. If you're over 30 to 35 years old and getting towards the end of your most fertile period, it may be that your body starts to release more than one egg at once, thereby increasing your chances of releasing multiple eggs, 2 or more eggs, which then become fertilized and lead to fraternal twins. Some studies have shown that having an increased body mass index of over 30 may lead to multiple pregnancies, although further research is needed. Assisted reproduction techniques have also led to the increase in multiple pregnancies. Many times, more than one embryo is transferred into the uterus to increase the chances of implantation. And if more than one of these embryo implants, it will lead to a multiple pregnancy. Over time and with research and development, current techniques allow single embryo transfer, which is allowing the reduction in the number of multiple pregnancies and therefore providing a safer pregnancy for the mother. Some studies have also pointed to the use of contraceptive pills increasing multiple pregnancies. When the contraceptive pill is stopped, it may be there's a bounce back effect where the body goes into multiple ovulation, but again, more research is needed to thoroughly understand this subject. The evolution of a twin pregnancy or a multiple pregnancy is basically the same as the evolution of a single pregnancy. However, with 2 babies, it may be that some of the symptoms are more pronounced. You may experience more nausea or more fatigue. As you've got 2 babies growing in there, the uterus is going to be bigger. You may have more sensation of heaviness and fatigue, requiring a little bit more rest than usual. What is important in a multiple pregnancy is that you go to all of your regular checkups, and there will probably be more of them in a multiple pregnancy, to ensure that all of those factors we've talked about, all of the risks, are under control and that the pregnancy is evolving healthily for both you and your babies. And don't forget that once those babies are born, which may be by a cesarean section or not, it depends on your individual case, you are going to need a little bit more help than those mothers who just have a single baby. So do be prepared. I'm now going to look at a couple of the most frequently asked questions that we get from our users and answer them for you. How can I get pregnant naturally with twins? Well, the short answer to this is you can't. If twins don't tend to run in your family and you don't have a genetic basis, it may be unlikely that you will have twins naturally. The probability of having twins depends on you having a multiple ovulation or on the single embryo splitting at a certain time to give rise to 2 embryos that then go on to develop. How is a twin pregnancy detected? Any pregnancy is usually first detected by that positive pregnancy test. The pregnancy test measures the levels of HCG hormone in your blood, the hormone of pregnancy. If there are very high levels of this protein present in the very early stages of pregnancy, it's the first indication that there may be more than one baby in there. A little bit later in the pregnancy, during an ultrasound or other checkup, in an ultrasound they may see the presence of more than one gestational sac, visualize 2 little hearts beating, or perhaps hear the sound of the 2 heartbeats using the Doppler. We would love to hear about your experiences of twins, multiples, triplets, quadruplets, perhaps even quins. So please do leave a comment in the section below. If you have enjoyed this video and found it useful and informative, then please don't forget to click like and subscribe so you don't miss any future videos. And I remind you, in the description below, you will find the link where you can carry on reading more about this topic in more detail. Thank you.